really the goal is just to use our stories to bring veterinary medicine to life for the pet caretakers of the world. And we're doing it because we believe that educating these caretakers is the most powerful thing that we can do to improve the life quality of all of the pets that we love. Hello.
Hello.
We're back.
We are back.
It's been a while.
It's been a minute.
Yeah.
Definitely for me.
Yeah.
Because I think you did a podcast with other people.
I did one, with the IDEX rep, Missy. Yes. I can't remember if there was more in between there.
Okay.
Maybe Kaylin and I don't think so. I don't know. Anyway, I'm Dr. Natalie Keith.
I'm Dr. Josiah Dame.
And this is Vet Tale.
Yes.
So today we decided to talk about one specific cancer called lymphoma. Mostly in dogs. We'll see if we get to cats. That may be part 2. We'll see.
Yeah. See it in dogs and cats. We've seen it recently a lot. Just these things happen where you feel like you just did a slew of them. But I think every associate has had a lymphoma dog in the last 2 months.
Yeah, 2 for me. It's one of the most common cancers that we see. I think I think it's like around 10% of all canine cancers are just this one cancer.
That's crazy.
Yeah. And so then the other 90% are all the other billion kinds of cancers. Very common. And
yeah, we're going to start with dogs.
Yeah.
And kind of discuss how they present to us. What do we notice? What breeds?
Yeah.
What age group?
Yes. How do we dive deeper into diagnosis? And then what are our options for treatment based off of such things? So,
yep. Okay. Exactly.
Yeah. Okay. So what do you want to start with? Signalment?
Yeah. Let's start with signalment for sure. So typically middle-aged to older dogs, but lymphoma is one of those stinky ones that like puppies will sometimes get it. So like young dogs, like a 1-year-old, and that's the worst.
It absolutely is. And we see certain breeds that get it more often. The boxer is overrepresented.
Boxers, Goldens,
of course. A study that I was looking at said Rottweilers and Dobermans, but they're almost all Goldens and boxers of some kind. Although I've seen a lot of pit bulls with it recently. Oh. There's no breed that's safe.
Yeah. Not by any means. I've had a shepherd. One of the associates had a pitty. Another one had a Alaskan Malamute. It's just a widespread.
Yeah.
But when you see a golden or a boxer with a big lymph node, you immediately go, great.
Yeah, absolutely.
Immediately your heart kind of sinks.
Yeah, it does. Yeah, because there's just so little else that's going to cause like a generalized lymph node enlargement. And as soon as you realize this dog has multiple lymph nodes that are large and otherwise looks okay, you're like, oh, yeah. Okay. I know that this seems like not a big deal, and it absolutely is a big deal.
It is a big deal.
I've had 3. I've had 3 boxers in. So Thunder was my first one of this little run here. And that was 3 months ago. And then his sister, Cedar, right after that, like literally weeks after Thunder died. They're both boxers. Cedar was diagnosed.
Blood siblings?
No.
Okay.
No, not blood related. And she actually was older than him.
Okay.
Thunder was only 5 and Cedar was like 7.
Okay.
And then I just had another boxer that was recently diagnosed. And she's okay still, but it's just, that's only been like a week ago.
So kind of when we look at our schedule and we see our appointment, at noon, you're going to see XYZ, who's a boxer, and the owner's noted some swelling around his neck. And that has them concerned. And so...
Or has a knot under their chin.
Has a knot under their chin, is swelling around their neck, has a mass, maybe he got stung by a bee. Those are kind of what the appointment notes say. And then we go in, we do our physical exam. We always palpate 3 areas for lymph nodes in dogs because there's 3 that you can typically feel on exam normally. And those are the popliteals, which are right basically in the crux of the knee. The prescapulars, which are in front of the scapula.
Right. So like the front of their shoulders.
Front of their shoulders, exactly. And then the submandibular, which are going to be under the jaw, which those get tough because there are salivary glands there too. Sometimes.
And I feel like those are the most likely ones to get enlarged for non-lymphoma reasons.
Exactly. Yep.
But when you feel a big popliteal on both sides, you're like both of the popliteals behind the knees are big, you're like, this is bad. This is bad.
Yeah. And then we usually, tell the owner, hey, we need to poke these lymph nodes, put them onto a slide and look.
Yeah.
And that is called an aspiration cytology. And so we will poke those lymph nodes, put them onto slides, stain them, and then look at the population of cells. We can, with pretty good confidence, give an answer, yay or nay, if they are blastic, which is a fancy way to say big lymphocytes that are all throughout, and they have a lot of changes within the inside of them that make them look cancerous.
Right. They're like baby lymphocytes. They're brand new ones, but they're replicating so fast, they're not replicating well.
Yes.
And so they look odd. And yes, and so that's your really big red flag.
Yeah, those are your big red flags. Those are your like slam dunks. And then you can get what they call intermediate, which is kind of like an in-between, which is when it gets tough because you can have reactive lymph nodes that also look like that. And then there's something called small cell lymphoma. So it's not blastic. They're not big, blasted big. They're small and they look actually kind of normal, but we'll get into that too.
Yeah.
But what do we do once we get those slides?
Well, yeah. So, it depends, and I think it's worth maybe clarifying too, like you said, reactive lymph nodes. So what he's saying is like there may be an infection localized or whatever.
Yes.
So we're going, okay, is this like a sick dog with just big lymph nodes that are fighting an infection of some kind, or do we have lymphoma? And even for me, even if I am really sure it's lymphoma, I feel most comfortable submitting those slides to a pathologist for confirmation. Yep. And then assuming that they say, yes, this is lymphoma, then we still have more work to do, right?
Yep. Yeah, we do. So basically we'll send off those slides. And then if it comes back, yes, this is lymphoma, and they may call it, small cell, intermediate, large cell. But then from there, there's also classifications that can occur to kind of help is this a lymphoma that maybe we can manage with chemotherapy, or is this like a really bad prognosis where sure you could try, but like you should prepare for a pretty quick kind of course of disease.
Right.
And so that test is called a PARR,
which is PCR for antigen receptor rearrangement.
And what does that do, Natalie?
So, please tell us. Okay, hang on, I can do it. So basically what it's doing is looking for clonality of the cells. So, okay, let's say that you have a reactive lymph node and it's fighting infection. Then all of these little blastic cells or the big blastic cells or whatever are going to have different DNA because they're just different cells. But when we have cancer, it will be what's called monoclonal, means they're all cloned of the same one clone, mono, as opposed to polyclonal, which is many. So they're all got the exact DNA conformation. And when you see a monoclonal spike, so most of the cells are the same DNA and they're the same basic cell over and over again, you have a cancer.
Yeah.
Then what's really great about this is that it actually will tell us, is it a B cell or a T cell?
Yes.
Which may sound like a small detail, but it radically changes the treatment options for the patient.
Yeah, definitely. And so B cell is bad. That's how they taught us in school. B cell is bad. So not good, bad. Cancer is bad. T cell is terrible. It is a just like quickly progressive form of the lymphoma. I have patients who I have a high suspect of lymphoma. I have aspirated tissue and gotten blastic lymphocytes back. I have sent out the slide. They have some labor changes you might see, not all the time, but sometimes with lymphomas, you'll see a really high calcium. I'll have that. I'll be like, hey, I think this is lymphoma, but let's, wait until I get my cytology back. Well, that takes time. I've had patients pass away just in the 2 days that it takes to get the slides back.
Yeah, but the PARR testing is wildly long. It can take 2 weeks. Yes. I have had patients literally die of T-cell lymphoma, Cedar being one of them, before, because her quality of life just went down like a stone.
Yes.
And we couldn't wait on the results. Now, I mean, of course, if you get back T-cell, which we did with her, there wasn't any chemo that was going to help anyway.
Probably not, yeah.
But they don't recommend doing chemo on T-cell patients. So most veterinarians that do chemotherapy require the PARR testing to even find out if it's
worth
putting the patient into the protocol.
Yeah, particularly the place we refer, she specifically wants to have the PARR test because she wants to know,
will it respond?
Will it respond to my protocol? And like, can I set up these owners for realistic expectations? And so, because we don't do chemotherapy here.
Right.
But yeah, I mean, just that particular client, I was just waiting on the lymphoma report just to say, yes, it's lymphoma. Then they're like, do you want to do PARR? And
is this the spleen dog?
This is
okay. Well, let's talk about that too, because that's like staging and substaging, right? Goes into that. So tell them about that dog.
Yeah. So I had a 10-year-old shepherd present for literally a day of not doing well. One day of not doing well. And upon evaluation, shepherds, when they come in and their belly seems a little bit bloated and firm, two things that I'm thinking of. I'm thinking of a hemangiosarcoma, which is a tumor of the liver, spleen typically, that causes distended abdomen and pain, or a GDV, which is the flip stomach. Well, I, did my lab work, saw high calcium immediately, even though I had already done it. I went back over all the lymph nodes, didn't feel anything. Well, I had previously ultrasounded the spleen.
Because calcium, by the way, is an indicator that you may have neoplasia present.
Exactly.
So the high calcium on the blood work made Dr. Dame go, wait, is there cancer somewhere?
Yes, particularly lymphoma will cause the hypercalcemia. And then there's another one called
the adenocarcinomas.
Agasaka.
Sucking it to me.
Yeah, Agasaka is anal gland.
Gosh.
Yeah, anal gland tumor, but
yes,
they call it Agasaka.
I've never heard that in school. We just called it anal gland carcinomas.
Our pathologist taught us
Agasaka. All right, okay.
And so, I was very realistic with the owner. I was like, hey, the rapid kind of presentation of this, like I could poke the spleen and see if I can get some cells back and then we can send them off, which I did. I did get cells back. I straight up told them that day, I was like, with the fact that it's in a major organ, it's in the spleen, not in a peripheral lymph node, that's staging it much higher and it's much more aggressive. And so I can't say it's T-cell, but expect this to be pretty quick progression. And I mean, 24 hours later, we were having to make a quality of life choice.
Because he was just thinking.
She just was not doing well. So,
or she. I didn't realize it was a girl.
Yeah. And then about 2 to 3 days later, I did get the report back. It was lymphoma. And so it was peace of mind, the confirmation of like, okay, like there's nothing that we really probably could have done.
Yeah. And I bet you $1 to a donut if you had sent that out for PARR testing.
We would have been.
Yeah. No, we don't. We would never do that in that case for her because, it's an academic exercise at that point. She was doing so poorly.
Exactly.
And that test is wildly expensive.
Yes.
So
how much?
Like $400.
Yeah.
At least that's what our lab charges. Your vet may have a different situation, but very expensive. And I also like that you brought up the point of routine lab work too. Like, because that's another thing we really talk about. Like, you can diagnose these dogs from an aspirate for sure, but routine lab work for checking for, like, because maybe the dog has tick fever. So like, let's look at the white count. Let's look at our platelets. Let's look for anemia. Is there anything else that's flagging the system that could explain why we're in this situation? And then also gives you a better indicator of how they may handle therapeutics.
Yeah. Exactly.
And they can have concurrent issues. Like Thunder, when he came in, he also had a raging UTI.
Wow.
And so we treated the UTI and he felt much better. And even though he had a T-cell lymphoma as well, he did really well for like 6 weeks, which is not typical for T-cells. B-cell dogs is a whole different story.
Completely different. And so...
Sorry, I got you off track.
No, you're good. So then we get the diagnosis of lymphoma. And sometimes this conversation happens before we get the diagnosis. Sometimes it happens after. It really just depends on like how the dog's doing, because we're not treating a slide. We're treating the patient, a living thing. And so we'll have that conversation of, okay, how do we want to move forward with treatment? Do you want to go get chemotherapy at a referral clinic? Do you want to just do palliative steroid care, which, if I'm being honest, majority of people, that's what they do. And it really just comes down to, I think, B, T, and age of patient.
Right. And then now we have the intermediate Laverdia, which is the oral chemotherapeutic that we can use just in general practice. That's definitely a step above steroids and antibiotics is needed, but it isn't the CHOP protocols or the true chemotherapeutic. As far as I have some stats on it somewhere. Let's see. Maybe I do. Okay. So, all right. So here's the deal. Let's assume that we have a B-cell lymphoma.
Mm-hmm.
This says that palliative care, which we defined as a prednisone or single agent kind of chemo, is median survival time of 1 to 3 months, which feels right to me.
Yeah. That's what I tell people.
Yeah.
Sometimes they last way longer.
Sometimes they do, especially, again,
Just
like if they have intermediate or small cell, I feel like it changes things. And yeah.
I usually tell people 1 to 3 months. Yeah. And I usually tell people you're going to notice the lymph nodes get smaller, and then you'll notice them get bigger. And that's when the pred is not working anymore. And then that's when you need to tell me what's going on.
Right. And sometimes you got to manage secondary symptoms too. Like let's say that they're on pred, but it's upsetting their stomach. So we need to add in, an acid blocker or sucralfate, other things that we can, or like Thunder, whenever he had his UTI. So we got an antibiotic going on. So then we have the gold standard is what's called the CHOP protocol.
Mm-hmm.
4 different chemotherapeutics used in combination. For those of you who are taking notes, cyclophosphamide, doxorubicin, vincristine, and prednisone. And it's a 6-month protocol. And the remission rate is actually 70 to 90% with a median survival time of 7 to 12 months, although sometimes greater than 2 years. And I have had a patient that went through the CHOP protocol at OSU and went into remission and did well for a couple of years.
That's awesome.
Yeah.
I know a cat who went into remission and did really well.
Cats are,
completely different.
Completely different. Then, so we mentioned this Laverdia, which is this oral at-home chemotherapeutic-like drug. Early studies are showing 75% remission with maybe, I don't know. What is TTP? I don't know. This is why you don't do live podcasts. We're gonna Google it for you guys. Because it's not actually giving me the mean survival time on that. So you tell them more about what else we're doing for pets in the meantime, and I'm going to look up at the space.
Yeah, so we'll be discussing with y'all, okay, here's your next steps. Palliative care, we could start steroids. If the dog's doing okay and it just has swollen lymph nodes, I probably will make you wait until I get the lymphoma report back, because what if we do have a tick-borne illness that's causing enlarged lymph nodes? And I don't want to put you on a steroid. I want you to put it on doxycycline, blah, blah, blah. So,
sometimes I'll just do both. Yeah. Time to progression. That's what it means. So it says 2 months before progression starts, and then you're back into that 3-month survival time.
Okay.
So
steroids are one option. That at-home kind of chemo drug is also an option in clinic. I have offered, obviously, both of those to people. Financially, a lot of people don't go for the in-home chemotherapy drug because it's more expensive than steroids. And then the third option is referral for chemotherapy, which, like I said, we tend to refer to somewhere in the city, and they tend to follow the CHOP protocol, but they do want the PARR results.
Do you know what those cost?
No.
Okay, I don't really either.
Most people, for me, do offer steroids.
Well, we were going to put Thunder into the CHOP protocol, but then he came back T-cell.
Yeah.
So I bet I could ask that client when she would tell me what she was quoted. But if I just was forced to guess, I would say $5,000 per run. And you probably do 2 or 3 of them.
Wow.
But I'm just guessing.
Yeah.
Just guessing. And that's in Oklahoma.
And we can add
yeah. And it would depend wildly based off of your region and so forth, I would imagine.
Exactly. But yes, you can have lymphoma dogs that do well, and then you have others that don't, even if they're B-cell. It really just depends on how their body responds to chemotherapy, which I think most people, being who we are, we've been around people with cancer, and we kind of know that these are the stats, but it's just the individual that it lands on, and if they respond or not.
Yep. Yeah. I remember that I had another boxer. This has been years ago, but one of my technicians that was working with me at the time, the dog had just been diagnosed the week before. And the owners had come in for euthanasia on the dog. And the dog looked pretty happy. It was wagging its tail and, and whatever. And my tech comes to me and she's having a crisis about this. She's like, I can't do it. I just don't think it's time. I don't think it's right or whatever. And I said, look at this chart. In 1 week, this dog has lost 9 pounds. By next week, she will be miserable.
Mm-hmm.
So it's just, you have to have so much, I guess, grace for whatever comes is going to come and accept that and just roll with it, because there's not any one particular outcome that is guaranteed.
Yeah.
Other than lymphoma is awful.
Yeah, it sucks.
And it's such a bummer of an episode. It was like we took a 2-week break, and then we were like, just for the record, the other topic we were considering was the human-animal bond. So
just a happier topic, which
is why this topic is sad, right?
Exactly.
Like, so if we didn't care about the animals, this wouldn't feel sad.
Yeah.
But I don't know. It's just frustrating because it comes out of nowhere. It happens really fast. It could happen to any dog at any time. And it's like a gut punch.
Yeah.
When you see those lymph nodes get big.
Every time.
Mm-hmm.
Yep.
Cats, I mean, we could briefly touch into the cats since we're just at 21 minutes. We have totally different protocols for lymphoma in cats. They still can get it really young, but they most commonly get it really old.
Mm-hmm.
It's usually in the bowels.
Yep. GI lymphoma. We probably hear, if you have a vomiting cat, you've probably heard all of us say it.
Yeah, like it could be lymphoma.
It could be lymphoma. And people are then...
Or diarrhea.
Yeah. It could just be general diarrhea. Could be lymphoma. Could be irritable bowel.
IBDs. Yeah, and I speculate, though, I'm just speculating, that IBD is a precursor to lymphoma, just because chronic inflammation can lead to cancer.
And I was at a talk last year with a pathologist from Texas, and he gets a lot of... Because the way that you diagnose GI lymphoma in cats is biopsy. So that's, I feel like a lot of cats don't get diagnosed
because people don't want to. They're old cats that are skin and bone. They've been losing weight for a year and they don't want to go to surgery. And I get that.
You don't want to do biopsies. And I understand that completely.
Yeah.
And so he states that he thinks that the incidence of GI lymphoma is probably much higher. And a lot of them were probably being classified as IBD on their biopsies at that time.
Especially the small cell lymphomas.
Exactly.
And so the great thing about it, though, is what I have done in my life with these cats that we can't take to biopsy, but we suspect could be lymphoma, might just be IBD, is I manage them as if they're IBD. We add it, so we do a diet change. It's not really helping. So we next level and we do a steroid. Okay, it's helping a little bit. And then at that point, I go, it's probably lymphoma. And I put them on chlorambucil. And then they do great for 2 or 3 years. It's so much fun.
It is a much slower progression of disease than you think of. I tell people this all the time too. I'm like, I know your cat's been vomiting for 2 years. And I was like, and I know that I just said lymphoma, and you're thinking they would already be gone by now. You'd be shocked at how long that progression of GI lymphoma can be in a cat, because they are...
Mean survival time with steroids and things can be over for years.
Yeah, it's like they're in that small intermediate stage for so long before it really... Yeah. And
the exception to that is your feline leukemia cats that get the mediastinal lymphomas, the juveniles, and those poor kids don't do well at all. So the mediastinum, just for the record, is in the chest.
And that's why FIV-FELV testing is important.
Yeah, they definitely, if you have a cat with feline leukemia, they are much more predisposed to developing lymphoma in the very near future. So,
and my friend's cat that in vet school got diagnosed with GI lymphoma, she started chemotherapy in Colorado State or Oklahoma State. I can't remember, because she was 4th year moved to Colorado, but she was treated for 4 years and she lived until she was 16 or 17. She got diagnosed at 12.
Yeah.
Crazy long period. And she not only had GI lymphoma, she had true elevation of her systemic lymphocytes. So she had...
Yeah, and then sometimes they'll have concurrent anemia with that too. So then you got to manage the anemia. But they can still, do well. So it's definitely a much, much different pathway for the kitty cats than the dogs. But the dogs are the ones that have been getting us lately. Yeah. If I've had 3, you had 1, Jessica had 1. I mean, that's...
Caitlin had 1.
So that's 6 just in the last little bit.
Yeah, the last 3 months.
Yeah. Yeah, it happens all the time. So...
I think the referral clinic has been getting...
Yeah, right?
Not annoyed with us, but we've been calling them a lot and being
what about this one? What about this one? We're getting good at it, though. We've got the process down. We take admissions to the chemo place on Fridays. Got it. Okay.
Exactly.
Anyway, all right, cool. Well, I'm sorry for the downer of a topic. We've been gone, and then we came back, and we just rained all over your parade.
No.
Yeah.
Next time, we'll pick a fun one.
Yeah, if not the human-animal bond, something more fun.
Human-animal bond is good. We could just talk about puppies and kittens.
Oh, that's a great idea. Yeah.
I know we've done that.
Like puppy breath. Why does it smell better? Or worse, depending on who you are. But like, I love
puppy breath.
Oh, God. It's like some days I'm like, I don't think I got anything left in me. And then I get a puppy with puppy breath, and I'm like, oh, yeah. That's right. I can do this.
For me, it's the Aussie's puppy breath. I don't know. I think it's better. But also, it's probably because that was my puppy as a child.
Okay, it could be.
A red.
Have you ever noticed that Dachshund have worse puppy breath? Like, it smells more like iron. Like they've got, like, blood.
I haven't noticed that, but my Dachshund has terrible breath.
Yeah. Well, next time you have a Dachshund puppy, see if you can discern the difference, like a higher iron concentration.
Well, right now, I can't smell very well if y'all can't tell my voice, but...
It sounds better than it did this morning.
Yeah, I had a very baritone.
It was very baritone, yeah. It was, it kind of caught me off guard first thing this morning. I was like, whoa, are you all right?
I was talking really low. That's go wrong.
Yeah, but now you sound great. So
more normal.
It's a tough allergy season, so we're all just in colds and you have a small kid, so
I have yes.
The little petri dishes that they are.
He started it.
He started it.
He did.
All right, cool. That's all we got. Y'all have a great one. I don't know when we'll make it back, but we'll get here eventually.
Talk soon.
Okay, bye-bye. Bye.